breast cancer, considering that October is Breast Cancer Awareness Month, and actually breast cancer is the #1 most common cancer in Kenya and the #1 most common cancer globally.
According to Dr. Kanjama, among the main causes that lead to cancer are excessive use of alcohol, smoking and genetic mutation.
Those who are younger, because 5% of women who get breast cancer are less than 40 years old. So especially if you have a family history of breast cancer, maybe you had a mom, especially first, what you call the nuclear family or first degree relative, maybe you had a mom who had breast cancer or maybe a sister, and it's important to even start the clinical breast exam. The youngest recorded case, you'll be amazed, the youngest recorded case is basically even a schoolgirl, but it's rare, but it happens. This happens especially in those who have what you call the BRCA1 and BRCA2 genetic mutations. So those ones can get breast cancer even at a young age. Weight, obese, you're not exercising, we're so focused on office jobs and all that. These are the things which basically have caused breast cancer to increase, as in we're getting more risk factors because of the way we live. Because it's like lifestyle plays a role. Cancer is actually considered to be like maybe diabetes and hypertension, an NCD, what you call a non-communicable disease. And non-communicable diseases have been increasing as the years have been going by because of our lifestyle. The things we're eating, we're not exercising enough, and we're gaining weight a lot. And even up to now, we say that it's good for a patient to know their breasts and feel their breasts, but there was this directive which was issued by American Cancer Society. They did some research and they found that actually breast self-examination, even though it's good to know and feel your breasts, you know how they are, because it's very important to see whether there are any changes in your breast. Change in the size, change in the shape, change in symmetry, change in the nipple, whether it's inverted or retracted, or there's some abnormal discharge, whether there's a rash on the skin of the breast. It's good to know about all these things. But the most important thing is you go to the hospital, you do a clinical breast examination. If you're at risk, or if you're above 40, above 50 years old, it's always good to do a clinical breast examination and to do even a mammogram.
Cancer treatment, which is notably the most expensive treatment, Kanjama says that obtaining a health insurance plan could go a long way.
I think the take-home message as far as cancer is concerned is that cancer is it's an expensive disease to treat. It's an expensive disease to treat because even when you have medical cover, it only covers usually up to a certain limit. It's an expensive disease. The earlier it's found, the better. They say prevention is better than cure. When it comes to cancer, when you find it in the early stages, the prognosis and the treatment is much better compared to when you find it in the later stages when it's advanced. The mortality was around 2,500. 2,500, it was number 3 after esophageal and cervical cancer. On average, the 5-year prevalence is around 13,000 cases. Then the incidences, the new cases, about 5,000 women are getting breast cancer almost every year. Actually, male breast cancer is there, but the percentage of male breast cancer is very low compared to female. The majority of breast cancer is in female. Among the males, it's just a small fraction. For males, the main thing you need to worry about are things like esophageal cancer, prostate cancer. Those are the ones which are a major problem for men. Breast cancer, very, very low risk of getting breast cancer, but there are cases of male breast cancer.
Among women, breast cancer leads with over 5,985 cases annually and 2,553 cases succumbing to it. The numbers are followed closely by cervical cancer, with 5,050 cases being diagnosed annually. Then esophagus cancer with 4,380. Then prostate cancer with at least 2,864 diagnosed cases being recorded annually. The pink ribbon is an international symbol of breast cancer awareness. Pink ribbons and the color pink in general identify the wearer or promoter with the breast cancer brand and express moral support for women with breast cancer. The month of October continues to mark the World Breast Cancer Awareness Month annually, and here alone in Kenya, the Ministry of Health claims that at least more than 5,000 women are getting diagnosed of cancer annually, with at least 2,000 succumbing to it. Kariuki for Switch TV, Nairobi.